Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, I'm going to talk to you about the signs and symptoms of the coronavirus, or COVID-19 as it's been named, and give you some tips on how to minimize contracting it and also minimize you giving it to somebody else. So COVID-19, the coronavirus, as it's everywhere in the world, has been declared a pandemic. It's not new. It's basically what's called SARS-2. So SARS-1, which was also an epidemic, was never declared a pandemic, but COVID-19 is a similar virus, and it's given the name SARS-2 or COVID-19 because it was discovered in 2019. So it's similar to the flu, but worse. So your typical influenza symptoms, it's body aches, fever, not feeling like yourself. With COVID-19, you have similar symptoms. However, a big difference is the respiratory part. The average individual who contracted the regular influenza virus or whatever variation of it was seldom had such severe respiratory distress. So the symptoms of COVID-19 coronavirus is a fever. Now, most places will define a fever as a temperature greater than 101.0 Fahrenheit, but you don't have to wait for it to get that high, especially if you're elderly. A lot of elderly individuals can be febrile, have a fever, and the temperature never gets to 101. So we're much more cautious with them. So again, it's fever, coughing, sneezing, and this really bad upper respiratory issue. So if you have any of those symptoms, you're encouraged to call your provider, be it a physician or nurse practitioner rather. Do not show up to the emergency room. Call if you have a hospital close to where you live, call them first. So I'm sure you've also heard of the term social distance. Social distance meaning you keep yourself 6 feet away from anyone, regardless. Of course, if somebody is coughing and sneezing, sneezes can travel, the droplets from sneezing can travel much further than 6 feet. We're talking about a regular individual. You have no idea what they have, and you're going to treat the person that way. Keep yourself 6 feet away from everyone. Social distancing is what is used now to minimize you getting the virus and spreading the virus. It must be noted that a lot of people carrying the virus have no symptoms. Young people. A lot of the research also coming out from Centers Disease Control and information is that there are a lot of young people in their 20s who have the virus. They're passing it on to each other, passing it on to other people, showing no symptoms. So that's why the social distancing is really, really important. The individuals who are greatest at risk are elderly and individuals already with an underlying respiratory problem, heart disease, diabetes, any autoimmune disease such as lupus. These are the individuals that you're going to see sadly more often, not only getting COVID-19, but also dying from it. Of course, they're outliers. They're individuals who are younger, have none of those comorbidities or past medical history, and they're also succumbing to COVID-19. So what can you do besides social distancing? As a nurse, I teach this all the time. Wash your hands with soap and water. Antibacterial soap. Teach children to wash their hands. And specifically, wash your hands before you eat, before you touch your airway, before you touch your eyes, before you touch any body cavity. Wash your hands and wash it frequently. The Centers Disease Control also recommend an alcohol-based hand sanitizers. If, Purell, etc. I know some of those are off the shelves, but in most restaurants, some of those are closed, and other certain establishments will have a hand-based sanitizer that you can press your hand and get a squirt and hand sanitize. But hand washing, soap and water is excellent. There are also disinfectant wipes, if you can find any of these now. So we still have some. They have some that are specifically for your hand, as well as cloth pads you can wipe down certain areas. I encourage you to be mindful of doorknobs. I still see people coughing in their hand, which just really bugs me. That same individual now may take their hand and touch a doorknob. You come after them, touch that same doorknob, and if you put it towards your oral or nasal cavity, that's how you can increase your chance. I suggest you do that. This is the hottest item around now, and this is an N95 mask. Healthcare individuals normally use this whenever they are caring for somebody who's on airborne precautions. This would be the PPE for someone on airborne precautions, such as tuberculosis. Now, in the beginning, the news about COVID-19 was that it was droplet. Still is droplet. So the regular blue surgical mask is fine for droplet. So that will just limit the exposure of the virus, but you can still breathe through that. So you'll see a lot of healthcare workers, if they believe it's droplet, that's fine. And if they also believe it's airborne, this is better. So this is your N95, and I have one. I don't walk around with it, but I do have one. So that's really important. So just to recap, the signs and symptoms of the coronavirus, COVID-19, first and foremost, you can have no symptoms and be a carrier. That's important to know. Second, you could have a temperature, a fever. So if you feel warm, take a thermometer, digital thermometer, and check your temperature. You can have a sneeze. And the part that's really of concern to us is any shortness of breath, any respiratory problem, especially if you never had any underlying respiratory problems such as asthma, emphysema, and bronchitis. But if you do, if you're one of those individuals in our society who are amazing and lifelong dealing and living with chronic obstructive pulmonary disease or diabetes. Diabetes is, a lot of people in our society have diabetes, as well as heart disease, any autoimmune disease, again, I mentioned, such as lupus, and anyone who's immunosuppressed. You might have been an individual who had a cancer diagnosis and you were receiving chemotherapy. Well, the chemotherapy will take care of the cancer cells, which is what we want. That same chemotherapy can suppress your immune system and now put you at greater risk to contract such as COVID-19. Ladies and gentlemen, with all things, be good to yourself. Drink a lot of water, replenish your fluids. If you speak to your provider, take something for the temperature. At this point, there is no vaccine for COVID-19. They're basically treating the symptoms. If you have a fever, you're febrile, they will give you an antipyretic, such as acetaminophen. You'll be hydrated if you're dehydrated. You see a lot of people being put on a ventilator. Now this, I know people call this a respirator. It's an N95 respiratory mask. When we talk about a respirator ventilator, we're talking about the machine where you have to be intubated, where a tube goes into the branch of your lungs and helps with your breathing. So again, no cures yet. Here's the good news. There are a lot of people who are recovering from it, but sadly, as you see in the news, a lot of people are dying from it as well. So ladies and gentlemen, be good to yourself, be well. And as always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.